So I'm going to introduce Richard in a second, but I have heard ambition from each of our three speakers so far. And I really do want us to be ambitious as leaders, as people involved in helping people live good lives. Let's use ambition in everything we're doing. Ambition to overcome challenges, but ambitions to help people lead really good lives. So let's move on to our fourth and final speaker. And just a plug, get your questions ready, because as soon as we finish, we'll go into question and answers. In a way, my next speaker needs no introduction. Richard Webb, his legacy, his name, his ambition goes before him. He's currently the Director of Health and Adult Services at Yorkshire County Council, has been involved in ADASS for years. Without further ado, Richard, over to you.
Thank you very much, Stephen. I don't know quite how to follow that. I feel about 107 now. My chief exec will be really pleased because you described it as Yorkshire County Council. So we are going through devolution and local government review at the moment. So maybe you know something I don't. Thank you anyway. And it's a real privilege actually to be here today and to follow in the footsteps of such a stellar panel. Actually, I found myself both moved and inspired and in a lot of agreement with what people have been saying. So I think what I'm going to do today is really just give the perspective of a jobbing director over the last few months, really. And it's a bit of a cathartic reflection on COVID, kind of some of the things that I think I've learned personally, and the things that I'm trying to think about. And I've included some slides from a session I did last week with our managers in the county council. A lot of people saying they want some certainty, what's going to happen over the next 12 months, and trying to pick our way through that to say actually what's completely uncertain and where there might be some certainty and trying to look ahead. So that's where I'm coming from, and it's based on kind of the experiences that many of us have had in this room, people working around the clock, working weekends without breaks, and hugely busy during the week and feeling like you're an air traffic controller at time with everything that's going on. So the opening point for me early on in COVID, I saw this picture on the first slide, which is, are we really waiting for a return to normal, or are we ready to build something different? And I think what I've heard from the other speakers this morning is we really have a burning desire to build something different, and we're trying to create that picture now for the future. If we move on to the next slide, please. What I want to start, though, is for all the numbers, it's the human stories. To me, that's why it's so personal. And, you know, I would just like to start by remembering the 600,000 people and increasing globally who've lost their lives, the 45,000 people at least in the UK who've died, of which 19,000 at least have died in care homes. Those are really sobering numbers. And behind every statistic is a human life, a human story, someone who didn't expect to die this year, loved ones who are grieving. And we really need to think about not only those human lives and stories, also the families and friends who have lost people this year. And also, I think it's about thanking everyone who has given their all in this room and way beyond, the volunteers, communities, people in public services, the supermarket workers, the farmers, everyone who has been essential. I think when we've clapped for carers, we've been clapping for a whole huge group of people right across this country and the world. Next slide, please. And I think in so many ways, we are at a defining moment. We're on the edge, the precipice of something. We perhaps don't know what that's going to be, what that's going to look like. Some of it will be, dictated by events, I guess, and the mood and the feeling and things that ebb and flow. And I think for me, it's felt like a period of extremes. A friend of mine said to me, as a society, we've never been so connected, so much a community, and yet so isolated and fragmented and atomized during the lockdown. Next slide, please. And I was asked by our teams in the County Council about some of the certainties. Well, that's really difficult to predict. I guess for me, we know the virus is still out there. Mercifully, the figures, the cases are, and the deaths are much lower. It's still there. And we know a vaccine, even though there's good progress being made, is some time away, and mass vaccination may be a while off. Lockdown's easing, but Leicester has shown that it can be bumpy and volatile and confusing. And I've got responsibility for public health as well as social care, and that's the same for lots of people in this room. For me, test and trace feels as full on as the earlier work around PPE and care homes and everything else. We know that second wave and a severe winter is highly likely, and we're all already working with NHS colleagues to plan for that. And as has been said already, the economy is facing big challenges. The spending will come to an end at some point, and we may face, we're quite likely to face some kind of new austerity, and whatever that will mean. And the other thing that really strikes me is that we're in different stages of recovery, restart. There seem a lot of R words going around at the moment, restoration. I think councils actually often feel a bit different for that, and particularly those of us in these roles and public health roles. I was joking to our chief exec the other day that I worry about being stuck in a COVID bubble as everyone else moves on, all the normal life kind of moves on to some extent. And particularly, I think I've noticed it with hospitals that they've moved on to a very different agenda in some cases, where primary care, community health, the care sector is still very much in response mode. And I suppose the other thought that's just on that slide is that for all of us who've lived through it, COVID will change us forever, how we live and how we work. And there'll be kids who are, 4 and 5, who will remember that weird summer when mummy and daddy taught them at home, and they'll be 95 and telling their great-grandchildren about that, hopefully in a very different world and a world that's moved on. But it will stay with all of us forever. Next slide, please. And just a moment to reflect on the kind of comfort of the past. I think one of the most powerful things that's come out of this period has been the whole Black Lives Matter movement and the profound impact that it's had. And I've deliberately chosen a picture of the statue of the slave trader Colston being pulled down, wrenched down in Bristol. And in so many ways, there is so much around this movement. It strikes me about the power of a social movement, and also the power and the importance of challenging our history, our assumptions, our language. And I'm absolutely with Anna on that word vulnerable. I really, it will be in my room 101. Whenever I see a press release from our media team talking about vulnerable people, it's one of the things I always strike out, the V word. We should not use the V word, in my view. And honestly, sometimes we seek a comfort in the past, and I can already see, amongst colleagues, people wanting to go back to whatever normal is. Well, the past actually had some great things. But also, was it really so good? Are we just seeing it through rose-tinted glasses? If we think about the time and energy it took to change things, the bureaucracy, the fear of doing something different, and bluntly, the impact our work has had on carbon footprint. So if you think about all those car journeys, all those short home care visits, all those trips to outpatients, when we could have done some of this online and in other ways. If we're genuine about asset-based community development, strength-based practice, there are other and better ways of doing it. So if we move on to the next slide, please. So I want to challenge this assumption about business as usual, another phrase that I think is overused and we should rethink. Do we honestly want to go back to what we knew? I feel really strongly, I don't want to go back there. I want to move forward into something different. And I think our other speakers have talked about that. So we need to recognise that. We need to recognise that not everyone will want to do that or go at the same pace. We need to move on. And we also need to allow people time to grieve, to be angry. I think to remember what has gone before rather than honour it. So I think, some of what's happened in the last few months shows that we need to learn from history rather than just automatically respect it. And we need to take the best of the past with us as we create a new future. And I think if we move to the next slide, if we think about our leadership, then all of this challenges each and every one of us as human beings and as leaders. And I've included a picture here of the Angel of the North, because I don't know what you felt, what other people have felt during this period. But in some ways, it's been the best of times and the worst of times. It really has been one of extremes, and maybe I'm just alone in this, but there are days when I've felt incredibly inspired. Everything, the teamwork, the sense of community all coming together, and you get a sense that you're preventing the spread of the virus and you're hopefully contributing to saving lives. And there are other times when there have been some really dark moments, and perhaps, I've certainly felt, am I up to this? Can I do this? Worried about people dying in care homes, worried about PPE. And sometimes I had a day off for the first time in 4 months, and I just went up to the top end of Northumberland to the Breamish Valley and walked for miles. And on the way, I stopped at the Angel of the North, which has always been an iconic place that I love, because sometimes you just got to go see an angel. You just got to reconnect and rebalance and think about our leadership and what that means for the future. So you can move to the next slide. There have been, as the other speakers have said, lots of positives over the last 4 months, and I'm not going to go through those in huge detail. The pictures here of the strength of our communities. I think community spirit has been fantastic. People doing incredible things to support others, both in a paid and an unpaid way, volunteers and community organisations. We've proved that we can work differently together as health and social care, and I agree with a lot of what Matthew said about the hospital discharge pathway. We've demonstrated we can work differently, more intensively, more in partnership with care providers rather than a purely zero-sum contractual basis. And that's involved some quite tough decisions. Certainly in my own area, that led to the closure of 2 care homes during the pandemic because we just weren't prepared to accept the quality of care. And we can work differently as organisations. We can make connections. We can do stuff online. We can work as a team around the issue. I think that's been really critical. So, from my point of view, I've seen public health, NHS, social care professionals working around the problems we need to solve rather than working through their labels. And I think even more so, it's been about co-production, particularly with, for me, it's been about people on direct payments, people who are family carers, co-production to try and get the right solutions to people as quickly as possible. If we can move on to the next slide, please, because we know there are significant challenges we still face, and the other speakers have talked about this. The inequalities exposed by COVID, we know about them. We've known about them for a long time. They are pretty stark. The experiences of certain individuals and communities, BAME communities, low-income households, people experiencing mental health issues. I think the hidden iceberg of domestic abuse. A lot now coming through about households in multiple occupation. I think that's going to be a big issue for test and trace, and linked to that, issues for migrant workers, people seeking asylum. Those seem to be big issues coming through now as we go into the next phase. And I wonder also whether this will highlight new potential inequalities. One particular issue for me, I think, is that of in-work poverty. So in somewhere like North Yorkshire, you'd think we're leafy and fairly affluent and the health indicators are fairly good. Inequalities exist in a place like North Yorkshire, in rural areas. They just look different. And they're often people on low incomes, doing multiple jobs, paying high rent, expensive transport costs. I think a renewed look at in-work poverty, as well as the obvious aspects of poverty too. And I think also the inequalities around people's lived experience. So I think Anna highlighted some of those, but for me, the experience of residents in 24-hour care, it was quite right at the start of the pandemic to prioritise freeing up NHS beds and building Nightingale hospitals. And I've been party, as many of you have, to that. However, the fear and trepidation and sense of bewilderment by residents in care homes and their families, I think, has been pretty stark. And also one of the other areas that I've particularly been conscious of is people who are family carers and people who use direct payments, because at the time when we were trying to get PPE and stop the spread of the virus, it felt that often family carers and people using direct payments were off the radar, that actually, because they weren't listed by the national regulators, they somehow got missed. And it became a bit of an obsession for me about making sure everything we did, whether that was, and we did do direct calls to everyone who used direct payment, sourcing PPE, had a particular focus around family carers and people using direct payments. And I guess all these issues raise two further questions. What can we do ahead of a second wave? And then what do we need to do longer term for the future? If we can move to the next slide. And I think that's also about the change that we need to create. Now, some of this is about government and wider decisions. Some of it is the power within this room and within our community. So how do we build on that power of community that has been phenomenal? And how do we show a bit more humility and learning and don't make assumptions on that, but really listen to people? It gives us an opportunity for co-production at scale. Personally, I think, the discharge pathway does provide the basis for something better in terms of bringing together health and social care. Many of us mobilised it within a 2-week period, redeployed lots of people into new roles. It's had its downsides, it's had its upsides. I do think it is a basis for working together, and I think Home First and discharge to assessor at the heart of that, at the heart of a personalised model. I think there's got to be a question about 24-hour care. What does that look like in the future? So if you are living somewhere that you think is your home, and then it almost becomes a transit bay for people coming out of hospital, and it becomes a place where people may bring in a virus or an infection from elsewhere, you've got to think about, does that feel like your home? And I would just wonder in the future how that will impact on people's behaviours and thinking. And actually, do we need to do more to accelerate a model that's different, a model of around supported housing, home care, housing and technology that looks very different? And maybe that's a space that all of us need to get into to accelerate further. I think there are some interesting issues about quality and regulation. Certainly during the period locally, I felt that as a council and the NHS, we've activated a much more interventionist approach around quality. We already did a lot before COVID, but I think we've stepped that even further, and in some ways stepped into a space that kind of perhaps is a gap currently, that we've orchestrated work with CQC and others, but I think there are some interesting issues about quality and regulation in the future. There's absolutely something about the workforce. You hear about the pay announcements and you wonder where the care workers are. I think personally there is an issue. We need some really good evidence now about pay and overcoming the big issues around pay. I think there is a strong case for registration of care workers. We need to work that through. And we also need to think about the new roles that we need into the future, because there are people who are coming into the care sector who perhaps have been furloughed, who bring different skills, different expectations, different experiences. I still hope we have multi-party talks and some form of longer-term strategy. Is that just a social care strategy, or is it part of a community strategy and inequality strategy? Who knows? But I think it needs to address both the cost of care and the sufficiency and of supply, for want of a better term. And I think we need to get a bit less precious about our labels, to be honest. I've kind of said this before locally, we are all public health now. We are all about health and well-being, and that needs to touch every aspect of what we do. I've talked about team around the issue, want to see us doing more of that. And I think the idea of a community coalition, a community alliance, building partnerships with people with lived experience, working across social care, housing, public health, community and primary care, really important. And let's see if we can have less of the same and more that's radically different. Think about our practice and our funding. And the final issue, I think, where we've got to really challenge ourselves and the whole sector is around culture and expectations. So I've talked about the V word. I think language is really important. We have some really good care, and, I want to thank everyone who's demonstrated that really great care during the COVID period. We have some really poor care, and I think we've all taken action to address that. And I know, closing 2 care homes and moving 30 people in that wasn't my ideal choice of doing things, but we've all had to respond in similar ways. I think the real challenge is mediocre care. The mediocre care that's faceless, that's bureaucratic, some of the things that Anna talked about earlier. And I think that's where the challenge is, the kind of computer says no culture that we really need to tackle. And that's hard to tackle, and we need help to tackle and to help each other with. And that's why I want to, my last two slides, if I can move to the next one, are about why it's personal and why those cultural issues matter. So this is a picture of Rachel's dad. Rachel lives in North Yorkshire, as does her dad. She has a pretty high-powered job, someone who's got lots of connections and resources and networks. Her dad was a guardsman for 30 years, a prison officer in some really tough prisons in London and elsewhere. He's now got dementia, and he's recently been in hospital, and he's now going through the care system. And that hasn't been a great experience. People haven't remembered this guy, there looking proud in his uniform. He's kind of had some of the lowest common denominator experiences on hospital wards, being shuffled around, people forgetting his details, constantly asking the same questions. He moved into a care home for interim care. He's got diabetes. The first thing that happened, it may seem a small detail, but he was offered sugary tea. It's that attention to detail that, yes, may reflect a system under strain, may reflect issues about cost, but fundamentally, aren't they about humanity and common sense? And for me, it is personal. It is about each and every one of us. It is about what we would expect for ourselves, for our friends and family, and restoring humanity to the numbers and the arguments. So that takes us to the final slide for me. Back to that first picture about, are we waiting for a return to normal or wanting to build something different? And then I think a challenge to us, building on the quote, a pretty famous quote, what's our role in this? If not us, then who? If not now, when? Thank you very much.
Thank you, Richard. Some reassuring messages that followed the theme, some really salutary references to the impact that COVID has had on people's lives, but some really helpful suggestions towards the end there of things that we need to do. And, none of us can fail to be moved by the story of Rachel's dad, but equally so, none of us needed you to tell us about Rachel's dad, because we will all know Rachel's dads in our system. So for us, the challenge is not to allow Rachel's dad's experience to become the acceptable and to shout out and make the difference that every one of us, every speaker this morning has said is possible, has been done, and can be done in the future.